Hi everyone, thank you so much for joining us today for our Employed Family Caregiver Support Program. Today we're going to be talking about organizing and planning for the future, and a lot of this is around long-term care. So we're going to start today with a brief overview about elder help and some of our services. We're going to talk about what long-term care is and some questions to ask around long-term care. How to start a difficult conversation with your loved one around long-term care, some important documents to have that pertain to long-term care, and medical decisions, as well as, of course, time for questions at the end. So here at Elder Help, our mission is to provide personalized services and information to help seniors remain independent and live with dignity in their own homes. And our programs are intended to reduce social isolation and any resulting health and medical issues. So a lot of our services are done by volunteers, and they can help with things such as going grocery shopping or just helping to give some companionship, as well as we have licensed social workers on staff to help with some care coordination. So what is long-term care? Long-term care is a range of services and support people may need to meet their personal care needs. And this can be medical care or assistance with tasks in everyday life. And a lot of long-term care is in the form of activities of daily living or instrumental activities of daily living. And 70% of people can expect to need long-term care after turning 65. So 70% of people are going to need help from others once or after they turn 65. And I just wanted to point out that when I'm talking about long-term care, this isn't to be confused with long-term care insurance. So who provides long-term care? Long-term care can be provided by a nurse, a home health aide, a therapist, any kind of medical professional, or it could be done at an adult day service or a senior center, as well as a long-term care facility, of course, like a nursing home or an assisted living facility. And 80% of care at home comes from an unpaid caregiver. So if you want to age in your home and get long-term care in your home, that is most likely going to come from a friend, a family member, a neighbor. Lots of family caregivers helping with long-term care. So some questions to ask around long-term care, and this can be questions to ask yourself or your loved ones. What are some of your goals as you age? So is this to spend more time with family and friends? Is this to travel, just to play more cards? If you begin to need additional support, who do you want to be providing these services? Do you want this to be a friend or a family member? Do you want to have a nurse or a professional be doing it? Where do you want to be living when you're getting these support? Is it in your own home, or is it in an assisted living facility, a nursing home? For most people, this is going to be in their own home. And do you plan on downsizing or moving? So in your own home doesn't necessarily mean it's the home that you raised your kids in. But before you downsize or move, are there modifications that you need to make to your current home to make it safer for you, or even just to sell it? And do you have a will or an advanced healthcare directive? So these are documents that will tell your loved ones what your wishes are for if you were ever to not be able to make those decisions on your own. So who pays for long-term care? It can be paid for by Medicare, and Medicare will kick in after spending 3 days in the hospital. They'll pay for up to 30 days in a nursing home, and while you're at the nursing home, you do need to qualify for skilled care or rehab care. After 20 days, you will have to pay copay while you are in the nursing home, and this will continue for 80 more days. So past 100 days, Medicare will not continue to pay for nursing home care. Medicare can also pay for home care. You need to be qualified again for skilled care, and it's through a licensed professional. So this is not for home personal care or household services. Medicaid or Medi-Cal, this is a needs-based program, and it can pay for hospital stays. doctor's appointments, prescriptions, and homemaker services. Going back to Medicare can pay for prescriptions just depending on the plan that you have. But Medicaid and Medi-Cal, biggest thing to point out there is it is needs-based and they will pay for some things in the home. Long-term care insurance, I will talk about in the next slide a little bit more, but they will pay for home care, assisted living, and home caregiving services, but your health insurance does not pay for these things. So that is the main difference between your regular health insurance and then these three other plans. So long-term care insurance helps to pay for the cost of long-term care, of course, and these are costs that aren't covered by Medicare, Medicaid, or other health insurance plans. Long-term care insurance, I think most people use it for home care services, but they can pay for assisted living, adult daycare, respite care, nursing homes, and dementia or Alzheimer's units. And long-term care insurance can be bought individually, but you can also buy it either through a group plan organization or your employer if they offer it. Most policies do have a limit, though, on the amount of benefits you can receive. So this is either a dollar amount or a time amount, such as a certain amount of years. So when you're looking into planning for long-term care, it's just important to look into your insurance policy or your loved one's insurance policy and what they qualify for. So having a difficult conversation, this can be at any stage of life really, but I am talking about difficult conversations that are around long-term care in specific. And this is really for when your loved one is kind of resistant and needing some more help, but don't want to admit it. So here are some tips. So be sure to start the conversation as early as possible. This way your loved one can be involved in their care, and this is ideally when they are still living at home and healthy. They can, explore different options with you and really let you know what they want and plan for in the future. This way, also by starting early, you can include others who are important to the conversation, other family members or loved ones. And remember, when you're starting early especially, decisions don't have to be made right away, and that's one of the biggest benefits of starting the conversation early. Start small so you don't have to solve every problem all at once. Figure out what is most important and start there. So maybe it's just where they want to live. Keep the conversation very simple, straightforward, and manageable. Don't make it too overwhelming. Talk about all different things at once, such as where they want to live, that they shouldn't be driving anymore, people who need to be making decisions as power of attorneys. Make sure that you're keeping your loved one involved and including them in the process of choosing and interviewing services or different places to live. Have them choose their top options in each category, such as their top options for living facilities and then their top options for home care. And be sure that you're including them in the conversation. Don't talk about them like they're not there, and let them know that their opinions are important to you about each of these services. Ask open-ended questions. So these are questions that can't just be answered with yes or no. And by asking open-ended questions, you can really find out a lot more and see how they're feeling about things and gain a better idea of what they're thinking about when it comes to these decisions. Use empathy and positive language. So empathy begins with listening. Listen to what your loved one is saying and turn it into a positive. So maybe getting some help in the home will let you guys do some more enjoyable things together because it will free up your time as a caregiver. And empathize with any tough decisions and changes that are coming. Start with opening statements like, I like how you have had this conversation with me, or you're keeping up with your garden, things like that. Be patient, and this is obviously a lot easier said than done. Many times difficult conversations don't happen all at once. That's why it's so important to start early. But be sure that you're staying patient, and the conversation can really just start with testing the waters and seeing if your loved one, how they respond to you bringing up conversations. So maybe if you're concerned with their driving, you can start with things like, so how's your car running? And then focus on independence. So older adults really can feel like a lot being taken away from them, such as their mobility or their ability to go where they want, their car. So be sure to just give them as much control as possible and look for options that really allow them to use their strengths. So maybe they can still go grocery shopping, but they just need someone to drive them to the store. So other tips with difficult conversations, remember to follow up with when necessary. So did they make that appointment that they said that they were going to? Know when to bring in professional help, such as a doctor, a social worker, or even just another person to bring up the conversation, another family member, maybe one of your siblings. Try to listen more than you talk. This can sometimes be really hard when you want the conversation to go a certain way, but really listen to what they're saying and use empathy, like I said before. And choose a relaxed setting and remember your body language. So usually these conversations are best to be had like in their own home, and make sure you're not making funny faces and that you have open body language. So some important documents to make sure your loved one has and you know where they are. First of all, know where any important documents are kept, and remember that important documents aren't just medical information. And something I think that's really important to know is important documents shouldn't just be locked up because in case of an emergency, a fire or a medical emergency, if your loved one is the only one that knows the code to that safe, you're not going to be able to get into it and find those important documents that you need. Or if there's a fire, a natural disaster, it may just take too long to get into that and get those documents out. A lot of people just choose to keep these in a folder near their fridge or somewhere where there's easy access, but the fridge is the first place first responders are going to look in case of a medical emergency, and they're going to look for things like diagnoses, DNRs, important names and numbers, contact information, doctors, medications, anything like that. And something that's often forgotten about when we're talking about this subject is the bills. What bills need to be paid in case of a medical emergency, and when are they due? What are they? So the important documents to have, to just kind of break it up: medical and personal documents. So these are things like birth certificates, marriage certificates, death certificates, social security cards, divorce papers, military records, any kind of ID or driver's license or a passport, or citizenship papers, wills, trusts, any kind of insurance information, funeral or cemetery information, which can sometimes be really hard to bring up. Home maintenance documents, so any kind of mortgage or rental information, utilities, garbage, phone bills, insurance policies, property taxes. Health contacts and documents, so numbers to doctors, pharmacies, specialists, living wills, power of attorney, Medicare or Medi-Cal numbers, health insurance, VA IDs, DNRs or advance directives, and financial documents such as car insurance, car loans, titles, wills, bank information, tax returns, personal loans, number to a financial planner. And to go over some of these important documents that I have been talking about. So a power of attorney, this is a financial and a medical power of attorney. You can have two separate people, or the same person can be both. So this is someone that you put in charge of making decisions if you're unable to. And a HIPAA release, this is so that you can give your loved ones access to your medical records in case of if you're ill or incapacitated, or vice versa, you can have access to your loved one's medical records in case they are ill or incapacitated. So this is so that you can talk to doctors and specialists about your loved one's health information. An advanced healthcare directive. So this is a document that lays out what your decisions are for your quality of life and afterlife wishes and care. 5 Wishes is a really common program that people use to fill out advanced healthcare directives. And then a will or a trust. This makes it clear who will receive your assets and personal property after you pass. This is important to make sure there's no disagreements over an estate after death. And I would recommend, if you're wanting to fill out a will or trust, you contact either your attorney or an elder law lawyer for which one is best for you, because there are some differences between the two. So that is all I have for today. Be sure to join us next month for our next webinar on Alzheimer's and dementia for November. And just one upcoming event I wanted to point out is the San Diego Community Action Network. They have an event coming up on October 30th from 9 to 2:30 about planning ahead and decisions that will be honored for you, and this is free. So any questions that you guys have, feel free to ask them now. And here is my information and how to contact Elder Help if you do have any questions that come up in the future. Thank you so much, guys, for tuning in today. Have a great rest of your day.